So much to talk about in regards to the coronavirus over the last 6.5 months. It has definitely impacted our way of life. And to talk a bit more about that is our friend and healthy living specialist, Judy Gaman. Judy, welcome back. How you doing?
Hey, I'm doing great. I mean, given the circumstances, if we're all alive, we're doing fabulous, right?
That's
a low bar.
That is pretty much, that's pretty much the clause that I put in before everything. Given the circumstances, no, absolutely. And over the last 6.5 months, a lot of changes in our lifestyle. Hopefully temporary. We get back to a more regular lifestyle soon. But during the interim, we've seen where emergency rooms, hospitals were really limiting patients and doctors' offices to more COVID-related or being very strict in who they saw, which meant a lot of our own maintenance has been deferred.
And that's a real issue because heart disease, diabetes, all of these things, they don't stop for a pandemic. They don't know that there's something else going on in the world, cancer, you name it. We have to take care of our bodies. Now, there was this report out, and I'm going to completely debunk this, but, hey, you can just get your physical exam online, do it virtually. You can't have a physical exam online. I mean, that's just not the way it works. I'm the CEO at Executive Medicine of Texas. Nobody knows physical exams like we do. People fly in from all over the world to see us for these. You cannot examine a patient properly online. Now, if somebody has something that they can do a quick virtual visit, we're all for that. We think that that's appropriate in some cases, but don't you dare put physical exam and online together. There has to be the examination by the doctor. You have to listen to the heart, not just check the blood pressure. You have to examine the body physically, not just what you can see on a screen. I mean, this just really gets my blood boiling, so to speak.
Yeah, I'm not sticking my chest up to the webcam and letting the microphone pick up my heartbeat. I'm going to go in and let the doctor or my nurse practitioner listen to that and take all my vitals there That kind of blows my mind that they're trying to pass that off. But I guess if that's a way to make easy money, people will tell you anything is a great idea. But you mentioned diabetes, you mentioned obesity, you mentioned heart issues. All of those, of course, are comorbidities. We saw where the CDC said 94% of all COVID-related deaths had at least 2.6 comorbidities on average for those that have died. So all of these things you mentioned are things that can, although coronavirus may not be the primary reason somebody dies, it can help kickstart if you have some other issues, whether you know them or not. So physicals are a way to discover if you have some issues that maybe need attention.
Yeah, absolutely. And not taking their insulin because, I didn't get my prescription refilled, or not checking their blood pressure. People's blood pressure, if you're on a particular blood pressure medication, sometimes over time you have to make adjustments to that. So just because you're on blood pressure medication doesn't mean that it's always controlling your blood pressure. That's why we have to keep rechecking you. Certain cholesterol-lowering drugs require you to have a blood test. Not having that and not checking on your liver, that could cause damage to your liver. But there's so much that I could just say about this whole report that came out to get this physical. I'll give you one story real quickly, Tim.
Sure.
We had a patient, and on physical exam, the doctor noticed that they did not have hair on his legs below the knee on one leg, not the other. The guy had no symptoms. He looked and he said, I just noticed that you don't have any hair growing on your leg on this side. And the guy goes, I never noticed that before. Well, it turned out that the guy actually had a blockage in his leg. He wasn't getting proper circulation down to that foot. But that was the first sign. You cannot find things like that on a computer. You're not going to see that, and you cannot rely always on the patient to self-report because they don't notice everything. They're not looking at it through a medical lens. So the physical examination is so important with a good critical eye.
Yeah, that's a great story. I mean, that's I've never heard of that before. Had you heard of something like that before, where somebody was just missing hair on one leg? I mean, it seems like if you're a doctor, you would almost think would you even say something, because maybe somebody was shaving their legs and then just ran out of time and had to get to the doctor.
Well, not to toot our own horn, but this is why people fly in from all over to see our doctors, executive medicine, because we're all about prevention.
Yeah.
We're looking for these early signs. And sometimes, they're really right in front of you, and sometimes they're not. So just having that time with your physician, which you're not going to get on a computer, that time, our patients are there for several hours. You have to actually treat a patient as an individual, not check a box. It kind of takes me down the whole Medicare thing where people go, I get a physical in Medicare. No, you don't. A nurse checking your blood pressure is not a physical exam. We've started using that term so loosely that it's dangerous. And unless we get back to, the true physical exam where the doctor and the patient are spending time together, where we're getting lab values. I like to say that there's three parts to a true exam. There is what we find out from the inside, which is what we find out from blood tests and imaging and things like that. What we find out from the outside, which is the physical exam, looking at the patient, looking for skin cancers, places they can't even see, and then what the patient tells us. Because a lot of times the patient will give you the diagnosis if you just listen close enough. Because sometimes in what they say are all these little clues. But those three things are the complete exam. And without those three things, or taking away one or two of those, you are not getting the exam that you need to get.
No, that's folks, if you need, the last minute of this interview pretty much should be an advertisement of why you should go get a physical. There's so much that's involved in learning about you to find out how your body is on an updated basis, that now that the doctor's offices are a little more open up to accept patients for physicals, now's the time to make sure that you take care of you. Judy, always a pleasure. Thanks for your time. Be well, and hopefully we'll catch you again very, very soon. Thank you so much, Judy.
Absolutely. Thank you.